So permit me to read this letter. And it goes like this. Dear Rotimi, after much thought, I have decided to write this letter to you. You are a 1978 graduate of Ibadan. You partly went to Dublin. I mean, you sponsored yourself to Dublin in 1985 to continue your postgraduate studies in obstetrics and gynecology. This was meant to be for 1 year, 1985. 33 years on, you are still away from the shores and land of Nigeria. Yes, you have risen to the top of your profession as a clinician and in management. You have been described by your peers in the UK as an asset to the National Health Service system. Dear Rotimi, why not consider coming home? Yes, you have answered the call to a certain extent, working alone or with organizations such as Vesta, Mansag, which you have heard about. You've been on missions to UCH Ibadan, the hospital in Shagamu, Olabisi Onabanjo Teaching Hospital, FMC Abeokuta, FMC Abuja, we've been there twice. I've been to the Nigerian Law School to talk to them about doctors, beware, the lawyers are coming after you. I wear a Q badge because of quality. My tag is every Nigerian life is priceless. That is my tag. And we don't value life. And you cannot put a monetary amount onto life. Once it's gone, it's gone. You can't buy it again. When your engine oil, I'm departing from the script, when your engine oil is low, you top it up. When the heart knocks because you haven't looked after yourself, short of a transplant, which we don't have, the next thing is death. Recently, you facilitated a mission by 4 consultant psychiatrists to train 20 lay people in the IDP camp in Jos. There are very few psychiatrists in Nigeria. There are very few psychologists in Nigeria. People in the IDP camp are beginning to manifest psychological and psychiatric manifestations. There are reproductive health problems in IDP camps, STIs, unwanted pregnancies. But what are the obstacles? People talk about the insecurity in Nigeria. The work environment is not fulfilling. The attitude to work and to patients is a concern. But Rotimi, people die. People are killed in New York, Chicago, on the streets of London. There's insecurity everywhere, not just in Nigeria do we have insecurity. Nigeria has a population of 180, 200 million people. Yes, people die every day from accidents, from armed robbery, and all that kind of things. But that shouldn't keep us away from home. I come home regularly. People, when they want to go to Spain or to America, they get onto the plane. Oh boy, when you want to come to Nigeria, you fast and pray. Fast and pray for how many days? Because you are coming home. It's one of the things I talk about in the UK. Now, why do you need to fast and pray? You are going home. You are going to your homeland. There are over 40,000 Nigerian doctors in diaspora. In Nigeria, you have one doctor to about 60,000 patients. How are we going to deliver quality care? Ladies and gentlemen, please let me say, when I mention doctors, I am not doctor-centric. I usually use the word healthcare professionals because I value everybody in the healthcare system. The porter, the weakest link, is the strongest person. So please, it's not just about doctors, it's about everybody in the health system. The government has come to realize and recognize the need to reach out to you and your colleagues. There is the Diaspora unit in the Federal Ministry of Health, and that's led by Dr. Bola Olowu. For the very first time, the legislative arm of government has allocated some money for diaspora matters. And that was being championed by the minister, by Bola, by Honorable Abike Dabiri, and Rose Oko in the House of Representatives. So the senior special advisor to the president on foreign policy and diaspora matters initiated the PRIDE program, which the acronym is for the Presidential Initiative for Diaspora Engagement. They wanted diasporans to come back home, either for a week, a month, a year, or whatever. But along that same time, I was told to chair the Planning and Implementation Program. But the Ministry of Health also had another program called 11 to 1, either 11 months or 1 month or 1 day. And the Minister of Health said, these two programs are similar. Why don't you guys get together and work together? And that was what led to the development of the Diaspora Professional Healthcare Initiative, which Dr. Olowu spoke about. That group is in its infancy. It's less than 1 year. October last year, end of October last year, was when we got together, people from Canada, from America, Britain, Germany, got together. And not just doctors, nurses, and different healthcare professionals, saying, let us work together. So it's in its infancy. But what it's going to do, it will provide the critical mass required for human capacity building and skills transfer. We hope that this initiative will be the vehicle to drive the brain gain. Rotimi, a number of your colleagues have shown what can be achieved. But while I sat there before coming up here, what struck me was all of these were in the private sector. Who's looking after the primary healthcare system? Who's looking after secondary care? Who is looking after tertiary care? Not everybody can afford the services of the private sector. That was what struck me there. Yes, the terrain and business environment is rough and tough. Tell your fellow diasporans there are a number of areas they can bring the skills and knowledge to achieve the brain gain we deserve or we desire. These are knowledge capital in highly specialized areas, cardiac surgery, neurosurgery, like we've heard, even in primary care. My sister Tony, she's a GP, and 70% of the disease burden in Nigeria can be treated at primary care level. So please do not let us forget that. And there are GPs abroad So you don't need to say gynecologist. Let us also train the family physicians. We said there are over 40,000 Nigerian doctors abroad. Do you know how many nurses in America, all over the places? Physiotherapists, occupational therapists? A lot of them. We need the human resources. And the third point here is transformation. You can help the government in its health transformation program. And here it says, working collaboratively. That word we have heard so many times today. With home-based professionals, you can change the landscape. The government is keen to provide an effective primary healthcare system. Your concerns about the political will, integrity, corruption, the medical and dental council registration, again, is happening. But people are addressing it. You have the 5 Ps to overcome these obstacles and to ensure a successful transition. You have to be patriotic. Come on, look at the way Emeka spoke. Well, we cannot all be like him. And when I have told him I'm going to give him some estrogen hormones to try and calm him down, you need passion. You need patience. You need to partner with people. We want to see progress. But above all of this is resilience, which is what everybody has said. It's not easy. There are no medals. It's not easy coming back. You will meet all sorts of obstacles. You will not find your file unless you give money. So you need that resilience to weather the storm. Rotimi, I know you will answer the call. However, to have the cooperation of your home-based colleagues, that is my colleagues in all specialties, avoid being pompous and paternalistic. There are some of us who come from the diaspora. I don't use the word we're coming to teach you. We're coming to share knowledge because I learn as well when I come. So when you come with that arrogance, you will meet a brick wall. We're all humans. I was just privileged to go abroad, but I trained in Ibadan, and I'm proud of that. What I learned, who I am today, is because of what I got from Nigeria. The reassuring thing is that you have the professionalism and the passion to drive the brain gain movement. Nigeria's brain gain will meet its human capacity building, knowledge capital, strengthening of its health system. Rotimi, you are in a position to be an advocate and an instrument to reverse the brain drain. You are under the threat of Brexit or Trumpite in America. So all of us, we the diaspora. I tell them, even my children, yes, you have a British passport, but you're black. One day, somebody might come and say, all blacks should leave Britain. The Windrush, it happened. So let's think about coming home. There's no place like home. What will lure you back? I know what you want of government. It needs to address the pull and push factors, the root causes of migration. And there are lots of it. We need the capital outlay for the diaspora engagement program. We've heard that there's 150 million or billion, did you say, sitting somewhere in the ministry. This should be used. We have to remove bureaucracy. There has to be merit in promoting people. You have to reward excellence. Good living standards. Yeah, it has to happen. Rotimi, the brain gain, will improve Nigeria's health sector. One thing people don't know is that when you're in good health, you're going to improve the socio-economic development of this nation. Did we meet the Millennium Development Goals? Perhaps only Ondo State government met MDG 5. We've got the SDGs 2030. Is Nigeria ready to meet those goals? Health, SDG 3, I think, yeah, SDG 3. When you're in good health, you can do all other things. But we need to come together as diasporans and people at home to work together. This conference by the Nigerian Health Watch has tugged your conscience, my conscience. The Diaspora unit wants you. Nigeria needs you. Rotimi, will you answer the call? Well, do you want the answer? Like I said, I come often. When God tells me to come to Nigeria to eventually settle, he'll tell me. I will know. Let me tell you why. Let me tell you why. Look, I was a consultant for 20 years in Newcastle. I was at the top of my profession in Newcastle. My children had left home. There was no need to leave Newcastle. If anybody had told me that I would leave Newcastle, I would say, for why? But I'm in Essex. I've been in Essex for 6 years. Nobody pushed me out of Newcastle. I saw a job that I liked. I was an external candidate. There were internal candidates. I put myself forward and I got the job. I think I'm beginning to develop itchy fits. And I have never ruled out. My dream when I was younger was to build my own hospital and run it to quality standards. My mother was the matron of UCH Ibadan. You could walk on the tiles of UCH and see yourself. That was how clean UCH was in the 60s. So I know what quality is. When the nurses of those days lay the bed, you will not see a crease on the bed. So Nigerian patients deserve quality. They deserve my little knowledge, and I will give it to those who want. Abeokuta, they're like a sponge. They want us back. There are some people who will say, we know more than you. What do you want to tell us? But my appeal, and Her Excellency is here, because you've got contacts. People may say I've got contacts because the Minister of Health is my classmate and friend, and I talk to him occasionally when he picks up my phone. Perhaps Her Excellency will have more linkage or contact with him. So you'll be giving him this reply as to whether I am coming home. It's in here.